R.T. Floyd. I'm the Director of Athletic Training and Sports Medicine here at the University of West Alabama.
All right, so first I want to ask you all, so what is evidence-based practice to you?
Evidence-based practice is actually it's multiple things. I mean, it's the idea of using the best evidence that you have, which certainly varies, to get the outcome you need for the patients now. Some of that has been highly researched and proven that certain things, certain techniques, treatments, etc., are very effective. In other cases, it's the best that you can determine based upon your experience. It really depends upon this. Experience is a factor, and the individual situation is a factor. So it's not, you don't have evidence-based answers for every situation, every pathology, every condition.
Okay. All right, second I'll ask you, so how do you utilize evidence-based practice in the athletic training facility?
Well, I try to read journal articles, keep up with things I see, that especially with the patients, the kind of patients that we see. If I don't have a chance to read every journal article that I'd like to, but as I see things that come across my computer and my desktop that are similar to what kinds of patients I probably see, I look at those, review those, see what's going on. I go to lots of conferences and things where we talk about same kind of things. And then sometimes I'll actually talk to people in the field who have more experience in a certain, whatever it is, and get their input. And then we modify, in many cases over time, how we treat or how we manage or how we evaluate, for that matter, people. One example is in recent years, if we're using the lever test more to help us, not as the only thing, but to help us more in our evaluation of ACL injuries.
Mm-hmm.
But it doesn't replace the other things you have to do.
All right. I'll also ask you, do you feel prepared to practice like these evidence-based techniques?
For the most part, yeah. I think there's always, if anybody would answer that question and say, I absolutely feel totally prepared, I would question that, because there's, as I said earlier, there's a lot of evidence that we don't have yet.
Mm-hmm.
And nobody can have all the answers. There's way too many pathologies and situations and differences and all to have that. And so I would say that person is making a mistake if he or she says they have the ability to master evidence-based practice. But yeah, I feel comfortable that I can do it for the most part.
All right, I'll also ask, how much experience do you have with evidence-based practice?
Well, the term has not been around that long. It's also referred to as evidence-based medicine. So I don't know exactly when that was first became popularized, but in the last decade it's become a real thing. But I think we were practicing evidence-based medicine, should have been practicing evidence-based medicine well before it became the hot topic, before it became the demand for it and all. And to me, any practitioner, any medical practitioner and all, should always be trying to do what he or she thinks is going to yield the best results for that particular patient with that particular pathology. So I guess I've been, in some sense, hopefully practicing that for a long, long time.
Mm-hmm.
But we didn't call it that.
Yeah. All right, and then last I'll ask you, what's the most interesting evidence-based practice you come encounter with?
Yeah, I'll have to think about that a little bit.
Or like a study or something that really.
Well, there's some recent. You hear more talk here very recently about maybe cold is not, and I'm not totally up on this yet, but there's been some discussion about how cold is not necessarily all that effective for ankle sprains.
Mm-hmm.
And prior to, I guess, going back about 20 years ago, there was a lot of evidence that came out in favor of ice. So I hadn't figured all that out yet. I'm still looking at trying to weigh it out. Personal experience, I've seen what I believe to be some pretty good evidence that ice is helpful, especially in acute ankle sprains or acute other problems for that matter. By contrast, I haven't seen where ice has caused any harm, unless you obviously apply it wrong and cause frostbite. But I have seen cases where heat has been applied too soon, and that too soon is very relative, and had an ankle or whatever it is blow up and swell a lot. So I may not be doing some good sometimes by applying ice, but at least I don't think I'm doing any harm. Where if I applied heat too soon, I might be doing some harm. And so I've still got to sort through that.